Diabetes is one of the most commonly diagnosed ailments in the world, with 30.3 million individuals, that's 9.4% of the total American population, dealing with the disease in the United States alone. Scarier yet is that 7.2 million diabetics in the United States don't even realize they have it. Before you find yourself shocked by a diabetes diagnosis, make sure you know these 20 diabetes signs you shouldn't ignore. If you identify with any of these warning signs on the list, be sure to visit your doctor ASAP to get your blood sugar tested. 1. Unintended weight loss. While unintentional weight loss may seem like a dream to some people, it can also be a scary sign that your pancreas isn't working the way it's supposed to. Accidental weight loss is often one of the first signs of diabetes. However, weight loss may also help you prevent developing the condition in the first place. In fact, losing just 5% of your body weight may lower your risk of diabetes by as much as 58%. And when you're ready to ditch a few pounds, start by adding the 40 healthy snack ideas to keep you slim to your routine. 2 leg rashes. Are those spots on your shins the result of a dull razor or something more serious? Many diabetics are only clued into their diagnosis when small round or oval lesions begin to appear on their lower legs. These spots, known as diabetic dermopathy, are thought to occur in up to 55% of all diabetes diagnoses. 3 Persistent fatigue. If you're getting a good night's rest but still find yourself so tired you can barely function, it's definitely worth mentioning to your doctor. Diabetes often wreaks havoc on a person's normal blood sugar levels, causing fatigue in the process. In later stages, the tissue death associated with untreated diabetes can also limit circulation, meaning oxygenated blood isn't being effectively transported to your vital organs, making your body work harder and tiring you out along the way. 4. Blurred vision. While poor vision is hardly uncommon, more than 60% of the American population wears glasses or contacts. After all, sudden changes in your vision, especially blurriness, need to be addressed by your doctor. Blurry vision is 5. Recurring infections. Whether you're dealing with frequent UTIs or skin infections, undiagnosed diabetes may be to blame. The high blood sugar associated with diabetes can weaken a person's immune system, making them more susceptible to infection. In more advanced cases of the disease, nerve damage and tissue death can open people up to further infections, often in the skin, and could be a precursor to amputation. 6. Sweet breath. Sugary breath isn't as sweet as it seems. Diabetics often notice that they've developed sweet or nail polish-like breath before they're diagnosed. However, if you're dealing with this strange symptom, time is of the essence. Sweet breath is often a sign of diabetic ketoacidosis, a condition in which your body can't effectively convert glucose into energy, keeping your blood sugar at dangerous, potentially fatal, levels if untreated. 7. Excessive thirst. It's no surprise that most people could stand to drink more water. In fact, the majority of Americans are drinking less than half of the recommended 8 glasses of water each day. However, if you're finding yourself excessively thirsty, that could be a sign that you're dealing with dangerously high blood sugar. Patients with diabetes often find themselves extremely thirsty as their bodies try to flush out excess sugar in their blood when their own insulin production just won't cut it. If you're parched, instead of turning to a sugary drink, quench that thirst with one of the 50 best detox waters for fat burning and weight loss. 8. Frequent urination. When your kidneys have to compensate for the excess sugar in your blood, it often means you'll find yourself rushing to the nearest bathroom all day long. The combination of your kidneys working overtime and excessive thirst makes round-the-clock peeing a reality for many people with unmanaged diabetes. 9. Swollen gums. If you've noticed that your gums are looking surprisingly prominent, it's time to check in with your endocrinologist. The inflammation associated with diabetes-related high blood sugar often manifests in the mouth, causing oral issues from swollen and receding gums to excessive bleeding when you floss. 10. Decreased libido. If your sex drive has gone from non-stop to non-existent, diabetes may be to blame. The poor circulation and depression that often accompany diabetes can make it difficult to become aroused.